Good evening to everyone and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Another 48 hours more. I hope you're all fully energized, ready to attack. Almost 2.5 lakhs, 250,000 warriors are fighting for a handful of 5,000 government seats in MD. But a great warrior like Alexander never worries to look at the crowd that he need to battle with. Once you get into the battle, automatically you will remember what all that you read, and your sword will be churning the heads around you, and you'll be progressing forward. So that should be the courage and audacity when you face the tomorrow's NEETPG exam. So as a part of our sprint series, let us make the revision very brisk. Always start your preparation with PYQs, end your preparation with PYQs. We always have a mental inertia to solve the previous year questions, thinking that first we should finish theory and then come back. Please don't do that. We have converted each of these PYQs into a single liner and attach it to that what is the topic that it belongs, and then consolidated these 10,000 PYQs into 10 sprint ebooks on the learnograph.com. So today only go and download from the learnograph.com. Nice to see Rajesh, Kirti, and many more. Can you please punch us the voice loud and clear for all of you, doctor? So now let us chase the PYQs. So once you go to the learnograph.com and download, you get the Spring 12 PDF like this, where single liner topic classified rapid revision, NEETPG 2014 ka questions, and these are all the topics, 1,000 topics from which the questions came. So this will give you a bird's eye view about the areas examiner is interested. At least if you don't get time to review the content, at least एक मर्तबा टॉपिक्स तो रिव्यू करो ताकि कल के NEETPG में आपको आसान हो जाएगा. So after the topic index, you have the actual questions in NEETPG 2014, what topic it belongs and what is the item all about. Good to see 15 online classmates. Good evening, sir. Getting nervous, sir, as it is nearing. Oh, come on, Pooja. Winners should feel stronger to take the chase of the lion, right? Like a Tarzan in the forest. Have you seen the Tarzan comics in the childhood? When the lion comes, the Tarzan holds the lion and fights, now like that. You should take head-on collision, and automatically what all that you know, these PYQs, everything will come into your mind and you will do miraculously great in the tomorrow's exam. So never lose the battle even before the battle started. That's the rule. Botulinum toxin, Corynebacterium, diphtheria's toxin, how do they work? What is their mechanism? Favorite question. Botulinum toxin inhibits the release of the acetylcholine. Haemophilus influenza, it requires factor X and factor V. It grows on chocolate agar. Diphtheria, it is the low-flood serum slope which is used for the diphtheria is what you need to remember. Rickettsia typhi, what is that reaction called? Neal-Moser's reaction. Neal-Moser's reaction. It is in the testis, there will be a tunica reaction positive if you are injecting the into the rickettsia typhi antigen, which is called Neal-Muzzer's reaction, is what you need to remember. Only that much you remember for the tomorrow's NEETPG bus. Don't worry, don't bother much about it, right? And one question will come from this dirty topic called rickettsia, doctor. There are so many vectors, causative agents of different types, epidemic typhus, endemic typhus, everything you should know. What are the most common species that lead to intravascular catheter related infections? Pseudomonas aeruginosa. Pseudomonas is incubated at what temperature? 40 to 44 degrees. Varicella zoster, chickenpox, belongs to Herpes viridae. Molluscum contagiosum belongs to pox virus. Rotavirus, double-stranded RNA virus with a segmented genome. Rotavirus is double-stranded RNA virus with segmented genome is what you should remember. Parvovirus is the smallest virus. Molluscum contagiosum is pox virus infection. What is herpes zoster? Reactivation of the latent infection of varicella zoster virus, chickenpox, is called herpes zoster. The most common complication whenever chickenpox infection is there is the bacterial infection. Herpes virus is most sensitive to the inactivation by the biocytes. Exanthem subitum is caused by human herpes virus 6 is what you should remember. Roseola infantum, human herpes virus 6. Hepatitis C belong to which class? Flavivirus, which is the only hepatitis. You have hepatitis A, B, then C, D, E. Only hepatitis virus that is DNA virus is hepatitis B virus. Defective hepatitis virus is hepatitis D virus is what you should remember. Maternal mortality highest in hepatitis E virus, which lead to fulminant hepatic failure, is what you need to remember. In hepatitis B virus, what is the product of the C gene? C. So many times question was asked on hepatitis B, hepatitis A, hepatitis E, hepatitis D. Last moment में you need to go back. Out of 200 questions, one question hepatitis virus के बारे में नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं है. Paper out. Right? Now, HBV DNA polymerase is encoded by P gene. In hepatitis B, what is an indicator of infectivity? Envelope antigen. Hepatitis B vaccination ka successful vaccination, sufficient immunity. What is a serum marker? Once you give vaccination, anti-HBs AG should be adequately developed antibodies. Then you will say hepatitis B vaccination is adequate. Who is a super carrier, doctor? Super carrier shows hepatitis B surface antigen positive, envelope antigen positive, HBV DNA positive is what you need to basically remember. So, very nice to see. Just now, a group of 6 students have downloaded the Sprint 12 of this PYQ series. So, Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So, totally 10 e-books में we created 10,000 PYQs. The previous year questions converted into a single liner and attached with a topic to give you a quick cursorial revision. So totally this comes into around 1000 to 1200 pages. We are trying to combine all 10,000 PYQs into one single PYQ book shortly. So that will help you always when you start preparation, start with that. With this PYQ single liner, topic classified, review by Dr. Murali Bharadwaj. Try to know what topics. You will take around 100 hours to finish these PYQs. Don't worry to mark them, remember them, etc. Remembering you can do later. The whole purpose of these PYQs is what? For you to know what examiner wants, what you should emphasize while you are preparing for the exam, doctor. Now, infectious mononucleosis pain. There is a positive heterophile antibody test. Coxsackie virus is isolated using a suckling mice. Which virus forms syncytium in the culture? Syncytium. That is, there are no cell boundaries. Measles virus. SARS is caused by coronavirus. Influenza pandemic will show cyclical trend is what you should remember. Among hepatitis, which is the oncogenic DNA virus, hepatitis B virus. How many days patient of HIV will be serologically negative? During that time, detection is difficult. It is called window period. 4 to 8 weeks is the time where he will be serologically negative. Whenever, as a healthcare professional, you have a needle prick, what is the risk of HIV? 1%. Poliomyelitis typically affects anterior horn cells. Anterior horn cells are the part of lower motor neuron. That's the reason there is an atrophy, fasciculations, decreased deep tendon reflexes, which are all the features of the polio paralysis. Human papilloma virus lead to the oropharyngeal carcinoma. Dengue fever is called bone break fever, which is called latent infection virus, hepatitis B virus. Kuru leads to human prion disease. Cytomegalovirus has owl-eye-shaped intranuclear inclusion bodies. Once more, doctor, there is a list. What are eosinophilic inclusion? What are basophilic inclusion? What are the Cowdery type A, Cowdery type B? All this dustbin things. If you have energy, remember, but tension mat lena, right? CMV में owl-eyed intranuclear inclusions का एक Google images में एक मर्तबा देख लेना. Isospora is stained with modified Gill-Nielsen stain. Plasmodium malariae will show band form in erythrocytes. So these band forms are the trophozoid stage. What is the shape of the gametocyte of Plasmodium falciparum? Banana shape is what you need to remember, doctor. Babesiosis, just like malaria, Babesia microti is another organism which is intra-erythrocytic in nature. RBC के अंदर ही वो निवास बनाता है. Babesia. Babesiosis is transmitted by tick. 7 Feldman's dye test is used for toxoplasma. Oviviparous parasite associated with auto-infection is the nature of strongyloides. Naegleria fowleri, it leads to meningoencephalitis with high fever. Can the online students can punch? Is the voice loud and clear for all of you, doctor? Please punch. Is the voice loud and clear? So, yesterday, our video of these PYQs could be able to make about 1700 views. I'm very happy that so many of you have commented. Very good session, sir. Really helped us, sir. Please do more of these sessions, sir. As teachers, we are vulnerable. We are very, very vulnerable to your compliments, doctor. We cherish them throughout our life. So that is the reason. Please like this video, comment below this. That will make this poor teacher almost last 25 years to teach students is my mission. Way back in 2000, when I said I start coaching program, there was no coaching program, especially South India में कोई भी coaching नहीं देता. सब लोग हंसे कि अरे क्या है MD के लिए coaching क्या है? So that time I myself was preparing for entrance. I used to hate obstetrics and gynecology. I used to hate to read SPM. But to teach students, I used to make notes and come early morning at 5 o'clock. I used to teach in a classroom. In that batch, in the first 100 ranks, 97 ranks came to our students. And I myself got the state top rank. And I joined the Nizam's Institute in MD General Medicine. So always I want to tell you, doctor, that have 3 to 4 friends or 4 to 5 friends. I will give you the study material that you need to revise like a parrot. The sprint ebooks, the snapshot ebook PDFs, the 50 full-scale grand tests, which we published on the learnograph.com are more than enough for you. You can download the PDF. One person can download and can share with your friends, no problem. But create a study group of 4 or 5 people, study together. There is no better way than studying as a small group of 4 to 5 than attending useless coaching programs, plan A's, plan B's, video libraries, unpacking of large study material. That's all is bakwas. What you need is 4 or 5 good friends, and you need to have PYQs first. 10,000 PYQs, I'll give you as one single PDF to you. Sit with a friend, 100 hours mein 10,000 khatam karo. Then you decide, these are the topics I'm going to emphasize. These I'm already good with. This is asked, I need to revise. Then go to the snapshots. All 20 subjects ke upar, I gave around 150 mind maps, which will do 1500 to 2000 high yield facts. A revision milega aapko. Every Sunday, there is a full-scale grand test and discussion. Already, there are 50 full-scale grand tests with image-based questions, just like the NEETPG exam. So once you do this revision, every day I come online and spend 1 hour with you to inspire you how you are preparing, free on the YouTube. So with this study material in hand, with 3-4 friends along with you, with Dr. Murli Bharadwaj as your everyday classmate, roommate, benchmate, automatically you become the winner in entrance exam. So, doctor, Matish Kumar, Jadhav, Kirti, Harish Ramsundaram, and many more who are all online. Good, doctor. So, toxoplasma show tachyzoids. So, you should know what is the life cycle, what are bradyzoids, what are tachyzoids, what are infective to the human beings. वो साइकिल एक बार रिव्यू कर लेना. नीटपीजी 2014 का PYQ है. Mucocutaneous leishmaniasis is Leishmania brasiliensis. Ascospore is a sexual spore. Malassezia fervor, spaghetti meatball appearance, pityriasis versicolor. You should know all this. How do you identify Candida? On the wet mount, using the KOH, you can find the Candida. The guinea worm, the intermediate host is Cyclops. How does bacterial conjugation occur? It is the R factor transfer which lead to bacterial conjugation. We use the HEPA filter to disinfect the air in the wardrooms. How do you disinfect the feces? 5% cresol is used to disinfect the feces. We use glutaraldehyde, 2% glutaraldehyde to sterilize endoscopes and laparoscopes. Heat labile liquid is sterilized by membrane filter. Cold sterilization का मतलब क्या होता? It is done by ionizing radiation. Hot air oven, how much temperature it will use? 170 degrees for 20 minutes. Like that, like a AK-47 rifle, tuck, 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 tuck. 10,000 ko, you have to bring it out like a generalized tonic-clonic vocal seizures. The moment you are able to do that, you are already yogi, Mahayogi, to become the winner in the NEETPG. No teacher, no coaching can help you unless it comes within you to realize what the examiner wants with the help of PYQs. Now, Riddle-Walker coefficient measures the disinfecting power. Very good. Just now, a group of 4 students downloaded from learnograph.com the entire sprint series of the PYQs. Very good, doctor. Hope it will help you for your preparation for a rapid revision. So, autoclaving, adequate or not, what is an indicator? It is the thermobacillus which will help you. So what is sterilization, disinfection, how are they different? Complete destruction of all the microorganisms is called sterilization. For the cholera, what is the stool transport medium? Carry-Blair medium is the name which you need to remember. In the blood culture, what is the anticoagulant used? SPS. What is SPS? If I tell you, will forget. Just go back and then check the Google what is SPS. In McConkey agar, what is indicator? Neutral red is the indicator. Blood agar is an example of enriched medium. Anaerobic culture specimen. How will you collect? Pus is aspirated in a vial. How long will you incubate aerobic blood culture? 14 days. What is the cause of the tuberculosis drug resistance, doctor? Because of the mutations. We use Gill-Nielsen for acid-fast staining. Which organisms show metachromatic granules? Corynebacterium diphtheriae. For intracellular structures, we use the polarizing microscopy. Thermophile bacteria, they grow at 60 to 80 degrees of temperature. On which organism penicillins are not effective? Mycoplasma. Why? Because mycoplasma is deficient in cell wall and penicillin act by decreasing the cell wall synthesis. That's the reason it is not effective on mycoplasma. Which organism shows a darting motility? Campylobacter jejuni. Which organism has peritrichous flagellae? Proteus. Endotoxin versus exotoxin, you should know the differences. Gram-negative organisms produce endotoxins. Endotoxins have no enzymatic activity. Wheel Felix is an example of a heterophile antibody test used for the rickettsia. The complement components are all glycoproteins. Any C1 esterase inhibitor deficiency lead to hereditary angioneurotic edema. Which complement components form the membrane attack complex, doctor? Terminal complement component pathways. Terminal components. What are they? C5, C6, C7, C8, C9 together will form membrane attack complex is what you need to basically remember. Graft versus host disease. It is also called runt disease. Typically, acquired IgA deficiency. Will any infection lead to that? Yes, sir. Congenital toxoplasmosis may acquired IgA deficiency can occur. So once more, all the primary immunodeficiency disorders, chronic granulomatous disease, Chidiac-Higashi syndrome, Jobs syndrome, selective IgA deficiency, Everything you should today only go back and do the revision down. Naegler's reaction. Naegler reaction is because of the lecithinase enzyme. It is a neutralization reaction. To mast cells, what will bind in anaphylaxis? IgE will bind. Trypanosoma cruzi is an example of amphixinosis. Rabies vaccine is contraindicated in the people who have egg allergy, is what you have to remember. Nosocomial infections are the most common of all. Nosocomial is UTI more than pneumonias. भारत में हम क्यों मर जाते? Road traffic accident is the maximum cause of the death in India. Division of labor को कहते हैं Durkheim's law. Durkheim is a division of labor. Why do we do medical audit? To improve the patient care. Why do we do clinical audit? We measure the current patient care against the explicit gold standard criteria को compare करने के लिए clinical audit करते. Daily disease, life years. It is a measure of effectiveness of disability is being counted, measure of effectiveness of treatment. Prevention of the development of the risk factors itself. School में ही अगर आप बताएं तो what is the importance of pap smear? What is the importance of not smoking? What is the importance of not eating from Pizza Hut? That is called primordial prevention. Screening for the disease is done for early diagnosis that leads to treatment. Hence, it is an example of a secondary prevention. What is disability? Lack of ability to do a normal function is called disability. How many days is quarantine in Kalra? 5 days. Which vaccine you need to avoid in the people with egg allergy? Influenza vaccine. Hepatitis A vaccine is available both live and inactivated. Who is a carrier? Carrier serves as a source of infection. What is meant by serial interval, doctor? How do you calculate? The time between primary case and secondary cases is called serial interval. So cyclodevelopmental, cyclopropagative, and propagative, 3 types of development you should know. Microfilaria transmission is an example of cyclodevelopmental propagation. Who proposed multifactorial causation of the disease? Pitton-Coffer. What is surveillance? Continuous scrutiny of the health-related factors is called surveillance. What is direct association, indirect association? So there are 2 variables, pati patni. उसके साथ पति पत्नी और ओ है तो उस ओ को बोलते हैं इनडायरेक्ट एसोसिएशन. दैट मीन्स एसोसिएशन एक्सप्लेन्ड बाय अ थर्ड वेरिएबल को कहते हैं इनडायरेक्ट एसोसिएशन. फॉर एग्जांपल, यू फाउंड दैट ड्रिंकिंग कॉफी led to lung cancer, but actually there are 2 variables here. One is lung cancer, coffee. But coffee के टाइम पे लोग ज्यादातर स्मोकिंग कर रहे हैं. एक्चुअल में lung cancer came because of smoking, not due to coffee. That is called indirect association. Sentinel surveillance means to detect the missing cases, especially in sexually transmitted diseases. We do sentinel surveillance. Whenever there is an epidemic, what is the first thing? You have to confirm the diagnosis that it is there. First step is to confirm, verify the diagnosis. What is proportional mortality rate? The number of deaths due to a particular cause is called proportional mortality rate. How do you know what is that indicated by this proportional mortality? It says what is the burden of the disease from diabetes, hypertension, femoral fracture, urinary tract infections, etc. You will know by proportional mortality rate. Case fatality rate is not a rate, but it is a proportion. Many times this question came. So, in which type of studies you can study the natural history of a disease? Only when you are continuously making the observation serially on the same person over a period of time. That is what is done in longitudinal studies. Cohort study में incidence calculate कर सकते मगर case control में incidence cannot be calculated is what you need to remember. Because in case control, the denominator is not the entire population, it is only those set of cases that you have taken. Hence, it can't calculate the incidence. Case control में already case हो गया. You are going retrospectively by taking history. So, it's called retrospective study. Rare diseases where the number of people are very limited available cases, you can't do cohort. So you have to do case control study. So what is the best epidemiological study? Meta-analysis. All India Institute में study हुआ, PGA में हुआ, जिपमर में हुआ, शंभुलिंगम मेडिकल कॉलेज में हुआ. ये पूरा स्टडीज को एक जगह पे लाके उसको एनालाइज करे तो मेटा एनालिसिस बोलते हैं. That is the best epidemiological study with least bias is what you need to remember. Selection bias. It typically occurs in randomized studies with volunteers. Because of your wrong selection, it can affect the study is what you need to remember. What is the specific death rate of TB? It is 5 per 1,000 population. What is the relation between positive predictive value and prevalence? Positive predictive value depends on sensitivity, specificity, and prevalence. The more the prevalence of a disease, the more will be the positive predictive value is what you need to remember. What is the measure that denotes accuracy? Typically, it is the validity of the test. हर एक टेस्ट को एक validity बोल के रहता. That is the indicator of the accuracy is what you have to basically remember. Whatever, we finished 123 PYQs super fast, rapidly like Vande Bharat Express. How much time we took? 5 minutes गप्पा मारने के लिए, पेप टॉक के लिए, पर्सनल सेल्फ एडवर्टाइजमेंट के लिए वेस्ट हो गया. एटलीस्ट हाफ एन आवर हमने 123 खत्म किया. बोले तो इस स्पीड में अगर मारे तो हाईवे के ऊपर 1 घंटे में 250 खत्म हो जाएगा. 4 घंटे में 1000 खत्म हो जाएगा. 40 घंटे में 10,000 PYQs एक मर्तबा पेंटिंग खत्म हो जाएगा. So for that, what you need to do, doctor? Go to learnograph.com, download the Sprint ebooks. Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Totally 10 ebooks अगर आप डाउनलोड करें तो आपको मिल जाएगा 10,000 PYQs from NEETPG 2012 to NEETPG 2023. So once you solve that, you know what examiner want. At least you have a database sitting in your mind. What is important? What is meant by ChatGPT? ChatGPT में पूरा databases को लाके dump किया, इसलिए it became more intelligent than human. It is able to crack USMLE exam also. So इसलिए what is needed for entrance exam? Database of PYQs. इधर खोपड़ी के अंदर आके बैठ जाना. अगर बैठ गए हम भूल गए, फिर बिठाए फिर भूल गए, फिर ट्राई करे, फिर भूल गए। मगर जिंदगी की सबसे बड़ी चीज नहीं गिरने में नहीं, गिरकर हर दफा उठने में है। एवरी टाइम यू फॉल, हाउ मेनी टाइम्स यू गेट अप विल बी द डिसाइडिंग फैक्टर वेदर यू आर ए विनर और नॉट। बार बार भूल रहे, कोई बात नहीं। टू फॉरगेट इज अवर greatest gift of the God. But don't fear that you will forget. You won't forget. If you don't want to forget, sit with 4-5 friends. उनको भी कुछ भी नहीं आता, आपको भी कुछ भी नहीं आता. Best situation. Download. One of you buy the sprint and share with your 3-4 friends. No problem. सब लोग मिलके, हमारे तेलंगाना में हम गाते हैं, बतकम्मा बतकम्मा बुयालो नी बिड्ड पेरे मी बुयालो, बतकम्मा बतकम्मा बुयालो नी बिड्ड पेरे मी बुयालो. There is a Batkama festival, just like Dashara. All the women will be dancing around and do Batkama song. Like that, you should do the PYQ revision. PYQ revision. Yellow fever में क्या होता है? Centrilobular necrosis. Which hepatitis virus is DNA? HBV is DNA. Like that, you need to do revision. Which is the replicating indicator envelope antigen in hepatitis B? Like that, you need to do the revision. Once you do, next level is what? Going logically and reading the high yield topics. High yield topics. Then you need to test in a mock test scenario. So there are 50 mock tests available, full scale grand tests, each containing 30 to 40 image based questions and 160 clinical vignette based like USMLE style. So a 50 full scale grand test को लर्नोग्राफ से डाउनलोड करके आप रिविजन करो. पहला PYQs को मास्टर करो. Then we also launch books called snapshots. Every snapshot ebook has got around 150 mind maps in which you have 1500 to 2000 high yield facts. बस ये 3 करो, रोज मेरे साथ पढ़ाई करो. सीट नहीं आए तो मेरा जिम्मेदारी. Right, doctor? So that is very important. Don't have too high expectations about entrance exam. It's a very chiller, cheap, chitka, simple entrance exam. Already examiner के मन में क्या है, बाहर निकल गया. Because even before you are born, some of you are 25, 26 years old. Need pre-medical entrance, pre-PG entrance exam is there for the past 30 years. Right? So, उस दिनों से यही questions का बार बार रिपीटिशन हो रहा है. But every time student will think there is a lot to be done to become a topper. Nothing. First know PYQs, set up the list of topics you need to master, drill very deeply, sit with 3-4 friends, solve the mock tests, and automatically you give 350 hours of your time. I will see that you get a rank less than 1000 to 2000 ranks. Right? Now, नेगेटिव प्रेडिक्टिव वैल्यू में न्यूमरेटर क्या होता है? टिपिकली इट इज ट्रू नेगेटिव. सेंसिटिविटी का फॉर्मूला ट्रू पॉजिटिव बाय ट्रू पॉजिटिव प्लस फॉल्स नेगेटिव. लाइफ एक्सपेक्टेंसी इज ए पॉजिटिव मोर्टेलिटी इंडिकेटर. एवियन इन्फ्लुएंजा वैक्सीन, इट इज गिवन इंट्रामस्कुलरली. मीजल्स एन्केफेलाइटिस में 10 to 20% मोर्टेलिटी. Measles में mortality is 10%. Measles में pathognomonic is complex spot. How will you rapidly diagnose TB? It is the sputum microscopy. In revised National Tuberculosis Program, what are the first steps? Sputum microscopy for TB suspects. When did we started stop TB strategy? In 2006. One TB unit is there for how much population, doctor? 250,000 in hilly areas. Once more, हम इस देश के वासी हैं जिस देश में टीबी बहती है। हम इस देश के वासी हैं जिस देश में टीबी बहती है। In this country where TB flows, not Ganga, TB. If there is a NEETPG without TB, revised National Tuberculosis Program, अगर नहीं है तो मैं त्याग पत्र दे दूंगा आपके अध्यापक की पोजीशन से, ठीक है? Definitely you need to revise RNTCP, definitely you need to revise leprosy. Without that, there is no question paper. So what are the RNTCP salient features? Cure rate 85%, diagnosis rate 70%. What is the definition of a TB relapse? Return of the sputum positive after cure is called as relapse. What is the dose of INS, doctor? 300 mg daily. What is the attack rate of chickenpox? 90% secondary attack rate. Chickenpox rash, is it centripetal or centrifugal? Centripetal. Maximum chickenpox spread कब होता है? Just before and after the onset of rash. What is the incubation of measles? 10 to 14 days. Incubation of influenza, 18 to 72 hours. What is the timing for the measles vaccine? It is given within 3 days of exposure in case of epidemics. How does mumps present, doctor? There is a pain and swelling of the parotids. What is the most common manifestation of mumps in an adult male? Orchitis. What is the most common form of polio? It is not symptomatic. It is inapparent infection is the most common manifestation of the polio. What is the mortality in rabies, doctor? 100% mortality. Who will do the HIV screening? It is the National AIDS Society, NACO is what you need to remember. Cluster testing is typically done for STDs. So what is the HIV prevalence? We call group 3 with less than 1% in antenatal and less than 5% in high risk population. STD ट्रीटमेंट पैक रहता है, वो पूरा कलर वाला पैक रहता है. In this STD treatment pack, blue pack is for the genital ulcers. So it should bring an inquisitiveness about what is this color pack of STD treatment, and you need to go back and do the revision. Cholera vaccination, you need to give in endemic areas. Hepatitis B endemicity is measured by surface antigen. Malaria parasitic activity data is measured by infant parasite rate. Malaria's efficiency, how good we are controlling malaria, known by ABER, annual blood examination rate. The rubella will cause the maximum damage, highest damage in the first trimester. AFP में सर्वेलेंस का इंडिकेटर क्या होता है? नंबर ऑफ AFP cases reported. When do you call polio eradicated? If there is no wild polio virus for 3 years, then you call polio eradicated. What is the dose of immunoglobulin for rabies? 20 international units per kg. Hepatitis A prophylaxis. How do you give? By giving immunoglobulin to the travelers who had exposure. Japanese encephalitis may, who is the amplifier in its life cycle? Pig is the Japanese encephalitis amplifier. So whenever there is any injury, what is the TT dose? 1 dose of TT with immunoglobulin. So more than 10% weight loss is one of the major signs in AIDS. So to diagnose acquired immunodeficiency syndrome, there are major minor signs. You should know the list. Typhoid oral vaccine, how will you give? Day 1, day 3 and day 5. Who developed rabies vaccine, doctor? Louis Pasteur. Most of the influenza infections are all subclinical. How much should be the Aedes aegypti index in the ports? Less than 1%. Who transmits endemic typhus? Flea. So what is calendar method? Fertile period starts on the 10th day of the shortest menstrual cycle, which is called calendar method. Based upon the cervical mucus thickness, if you can predict the ovulation, it is called Billings method. If there is any undiagnosed vaginal bleeding, it is a contraindication for IUD. Actinomycosis is a contraindication for the IUCD. What is Pearl index? It is the failure rate of the contraceptive per 100 women years. So you should know what is the formula, what is the multiplying factor in calculation of Pearl index. Mala D में iron content कितना होता है? 19.5 milligrams. Antenatal visits minimum 4 as per Ministry of Health and Family Welfare guidelines. In which phase our demographic cycle is there? India is in late expanding stage. What percentage of the women are 15 to 24 age group? 1/5 of India नारी शक्ति है 15 to 24 का. 1/5 of India, 20%. Least NMR is seen in Tamil Nadu. Perinatal mortality में denominator क्या होता है? It includes both the live birth plus stillbirth. So please go back and do the revision, doctor, because 2014 में a न्यूमरेटर्स, डिनोमिनेटर्स, इंडिकेटर्स के बारे में क्वेश्चंस बहुत पूछा गया है. कल के नीट पीजी में भी जरूर आएगा. सो व्हाट इज द करंट एमएमआर? प्लीज गो थ्रू आईएमआर, एमएमआर. विकिपीडिया में देखे तो मोस्ट रिसेंट 2024 का मिल जाएगा आपको. सो व्हाट इज द बेस्ट इंडिकेटर ऑफ मैटरनल चाइल्ड हेल्थ? It is the infant mortality rate is what you should remember. Whatever, I'm so happy to see 21 online classmates live and vibrant at this midnight, burning the midnight oil to become the winner. Don't worry, doctor. Dr. Murli Bharadwaj is your perennial classmate in the time zone. कल भी हम था, कल भी हम रहेंगे, आज भी आपके साथ है हम. एंड जरूर आपको मिलेगा सीट, प्रोवाइडेड आप हिम्मत नहीं हारना. जो भी शक्ति है उसको इकट्ठा करके लास्ट मोमेंट में हमला करते ही रहो. राइट? Keep trying. Many miles to go, many things to do. Arise, awake, and stop not until you become the winner, said Vivekananda. So, F75 milk formula, 0.9 gram protein per 100 ml. WHO के definition में adolescent का मतलब 10 to 19 years. So, what is meant by family contraction? जब USMLE खत्म करके पहला बेटा अमेरिका चले जाएगा, then the family will start contracting. What is the function of fluoride? It helps in dentition. What is the content of fluoride in drinking water? 0.5 to 0.8 milligram per liter. Dental fluorosis typically occurs if the fluoride is more than 1.5 milligram per deciliter. Neurolathyrism is caused by kesaridol. What is the folate requirement, doctor? 80 to 120 microgram daily in children. प्रेगनेंसी में कितना एक्स्ट्रा एनर्जी होना है? 350 किलो कैलोरीज पर डे. आयोडीन इन सॉल्ट शुड बी 30 ppm at production level. Wheat and maize lack lysine. और एक बार मेरे साथ बोलो, wheat and maize lack lysine. You can remember, wheat में W है, maize में Z है, lysine में Y है. WYZ, you can remember. Soya bean is called poor man's meat who can't afford to buy the meat. It is rich in protein, highest content of protein. इसका botanical name था glycine max, which we studied in 12th class. 12th class में बहुत खचरा पढ़ के हमने डॉक्टर बने, और ज्यादा खचरा खाए हैं हम MBBS में. फाइनली एक खचरा को पूरा साफ करके you need to become one of the finest consultants by becoming specialists and super specialists. Cow milk में 3.2 ग्राम पर 100 grams. इंडियन रेफरेंस में इनका हाइट होता है 161 सेंटीमीटर्स. इंडियन रेफरेंस वुमेन का वेट होता है 55 किलोज. एडोलसेंट फीमेल में विटामिन ए का RD रिक्वायर्ड डेली एलिवेंसीज 600 माइक्रोग्राम्स. विटामिन ए डेफिशिएंसी में फर्स्ट साइन इज ड्राइनेस ऑफ कंजंक्टिवा, कंजंक्टिवल जीरोसिस. Ionized salt to the entire community, we give it to prevent the goiter. Wherever we finished 200 PYQs. कितना देर लगा हमको? 53 minutes. 53 minutes में 7-8 minutes advertisement. लर्नोग्राफ को जाओ, PDF डाउनलोड करो, 300 rupees पैसा पे करो. Teachers also have become marketing agents, right? We have no other choice. So please, but do that, because we created these PDFs easy to share. देखो ऐप में बिठाए तो आपको सब्सक्रिप्शन करना पड़ता, सब्सक्रिप्शन एक्सपायर हो जाता, एक छोटा स्क्रीन में पढ़ना होता, बहुत मुश्किल हो जाता. बट लर्नोग्राफ में PDFs, the study material, you can download the PDF by paying $300 and can give it to 300 people. 300 दोस्तों को शेयर करो, कोई प्रॉब्लम नहीं है. बट अल्टीमेटली कंज्यूम द कंटेंट. दैट्स व्हाट आई वांट टू टेल ऑल ऑफ यू. कंज्यूम द कंटेंट, sit together, do the discussion. That is very, very important, doctor. So on the learnograph.com we have PYQs, 10,000 PYQs as single liners with the topic classified for NEETPG. Shortly, we are coming up with 15,000 PYQs of the last 15 years of FMG. FMG को भी इग्नोर नहीं करना, क्योंकि FMG, NEETPG, INICT ये सब 420 एक ही माफिया गैंग रहता है जो बनाता है क्वेश्चन बैंक को. Then there are 10,000 MCQs of AIMS INICT paper. So that also we will make single liners and provide to you. So a pura PYQ 3 volumes, NEETPG, FMG and INICT. एक मर्तबा रिवीजन करने के लिए आपको 100 घंटे टाइम लगेगा. Then we are releasing what are called snapshots, each containing 150 mind maps covering 2,000 high yield facts. And about 500 MCQs of USMLE clinical minute styled in each of these snapshot PDFs. Please download them. So that will give you the basic required material for you to do the revision very comprehensively. Then there are 50 full-scale grant tests which are made available, each containing 30 to 40 image-based questions with 150 clinical minute-based questions. You do solve them. Then there are 50 subject-wise tests according to a schedule. Every Saturday we have a subject test and discussion, live discussion. So once you do all this with 3 to 4 friends, and every day I come at least 1 hour, we'll spend together to study together. If you do that 5-6 months by day, to automatically from zero you will become hero. That's my promise to all of you, right, doctor? Because this is very simple, easy to crack entrance exam, provided you know the strategy of how to do that. I will tell you the strategy. एडल्ट मेल का प्रोटीन रिक्वायरमेंट 1 ग्राम पर केजी पर डे। पॉलिश्ड राइस में मैक्सिमम लॉस ऑफ थायमीन होता है। राइस इटसेल्फ इज अ पॉइजन, यू ईट राइस यू गेट डायबिटीज, सिंपल। बेबी जिंक सप्लीमेंट कितना देना? 5 mg पर डे फॉर 12 month old। चाइल्ड जिंक required daily relevance is 6 to 8 milligrams. What is biological value of protein? It is the percentage of absorbed nitrogen which is retained is called biological value. Vitamin K. So once more, doctor, what is the definition of specific dynamic action, biological value, protein efficiency, right? Respiratory quotient, all these things, specific dynamic action, you should know. NEETPG में they are very particular about these definitions of nutrition. Breast milk में which vitamin deficiency will be there, doctor? Vitamin K. Excessive maize खाए तो niacin का deficiency होगा और pellagra आएगा। In ICDS meal, how much is being provided? 600 calories and 20 gram protein for the pregnant women. Midday meal program mein 1/3 is calories and half of the protein requirement is provided. Famines mein what is the vitamin deficiency now? Vitamin A. Adult iron folate में 100 mg iron, 0.5 mg folate रहेगा। काला अजार का वेक्टर होता है सैंडफ्लाई, स्लीपिंग सिकनेस का वेक्टर होता है सीसी फ्लाई, वैगाबॉन्ड डिजीज का वेक्टर होता है लाउज। इफ यू डोंट नो, एग्जामिनर विल क्रश अस लाइक ए लाउस। कंपटीशन। हाउस फ्लाई का लार्वा, फर्स्ट स्टेज ऑफ इट इज ओरेशियस फीडर। ह्यूमन एनाटॉमिकल वेस्ट को हाउ डू यू डिस्पोज? इंसिनरेशन। व्हाट इज द हार्डनेस ऑफ वाटर? 50 to 150 mg per liter is moderately hard. Cytotoxic drug disposal is done by incineration. Animal waste के लिए yellow bag. Incineration is done for the category 6 waste. E-waste disposable is best for recycling. Oral cavity cancer in India is the most common male cancer, is what you need to remember. A vision less than 6/60 is the criteria to call blindness in India. The national program for control of the blindness goal क्या है? To decrease the blindness prevalence less than 0.3% by 2000. The most common cause of the blindness is cataract in India. Where are the oncology wings? They are sanctioned to medical college hospitals under National Cancer Control Program. Mental health program, 5% of Indians pagal hai. So mental disease is prevalent almost 5%. That means 100 classmates go to medical college means 5 log psycho hai. It all depends on with whom do you fall in love with. Now, most common mental retardation is mild mental retardation, right? And hospital infection. Hand washing, proper hand washing is most important. National Family Health Survey 3, when was it conducted? 2005 to 6. 3x5 initiative, treating 3 million people by the end of 2005 for AIDS. We use 3x5. आशा का इंपैक्ट कैसे मालूम पड़ेगा? अगर IMR कम हो गया, infant mortality rate if it is controlled means Ashas are doing their good job. Bicyanosis is cotton dust. Begasosis is due to the sugarcane dust. Continuous data. So there are two types of data, discrete and continuous. What is meant by discrete? Are you pregnant? You can only be yes or no. You can't be, oh, I'm slightly pregnant, I'm moderately pregnant. You can't say like that. Such type of data is called discrete. If I say, what is your weight? I may be somewhere 70 plus, 75 plus. You can be 70, 71, 72, 73. It can't be like 0 or some way. It can be a grade like 70, 71, 72. Such a data is called continuous data. Yes or no जहां आंसर मिलता है उसको कहते हैं discrete data. Continuous data के लिए we use the histogram. Histogram is what you need to remember. So ईयर वाइज लो बर्थ वेट बेबीज को अगर आप रिप्रेजेंट करना है तो बार चार्ट इज द बेस्ट वे. इफ यू वांट टू यूज ए क्वांटिटेटिव टेस्ट टू कंपेयर बिफोर एंड आफ्टर एनी इंटरवेंशन, बिफोर टेकिंग कोचिंग, आफ्टर टेकिंग कोचिंग, कितने लोग को सीट आया नहीं आया, इट्स कॉल्ड पेयर्ड टी टेस्ट. What is systematic sampling? It is done in alphabetical order, and every third person is being taken. That is called systematic sampling. Head impulse test. Typically, it will be positive in peripheral vestibular nerve injury. How do you perform mini tracheostomy, doctor? Through the cricothyroid membrane. A healed meningitis bullosa in the tympanic membrane has a sago grain appearance is what you should remember. Bareba, just now a group of 6 students have downloaded the entire sprint PYQ series from the Learnograph PDFs. Very good, doctor. I'm so happy. Hope it will help you, right? Now, left 10th cranial vagus nerve injury will cause a uvula deviation, but to right side. Please don't forget. A lumpy feeling in the throat relieved by eating is called globus pharyngeus. Where do you see strawberry tongue? Both Kawasaki and also scarlet fever, we see the strawberry tongue. Middle ear papilloma, how do you treat? Tympanomastoidectomy. What is the best time to do the hearing assessment? Objectively, first month of life. Darwin's tubercle, typically you see in the helix of the ear. Between the tragus and the crux of the helix, we see incissura terminalis. What is potato tumor? Hypertrophy of the sebaceous glands of the nose is called potato tumor. Ostman's fat pad, it is related to eustachian tube. Cauliflower ear is because of the hematoma of the ear. Foul smelling ear discharge is indicative in an adolescent boy, most likely due to cholesteatoma. Cholesteatoma is a misnomer. It is not a tumor, though it is oma. It doesn't contain cholesterol, even though it is cholesteatoma. What it contains is keratin debris is what you should remember. Congenital cholesteatoma ko, what is the criteria called? Levinson's criteria. ASOM, acute suppurative otitis media, most commonly is due to Streptococcus pneumoniae in children. In CSOM, most common organism which is collected is Pseudomonas aeruginosa is what you need to remember. Shivani Bhagat is asking, how long will this noise pollution will be there, sir? As long as you want, Shivani. हमको भी नींद नहीं आ रहा है क्योंकि 48 hours में नीट पीजी है, right? Lot of students को भी नींद नहीं आ रहा है क्योंकि 48 hours में नीट पीछी है. तो क्या करे? अगर शैतान की डर है तो भगवान की भजन करो, PYQs का रिवीजन करो every time you feel afraid. So revision of PYQs is done like single liners. इसलिए शिवानी हम भजन कर रहे हैं PYQs को फटाफट फटाफट at a rate of 250 kilometers per hour of pace bowling, right? So don't worry if you feel sleepy, go to sleep. But this video will be there tomorrow also. You can watch. Don't worry, doctor. How many of you still want the bhajan to be continued? Please feedback into the chat window, Dr. Motis Kumar, Jadhav, Kirti, Harish Ramsundaram. Until you have energy to follow the bhajan, let me know. मैं तो भजन करने के लिए तैयार हूं. Right? So next 48 hours, I told my patients, maybe I spend less time in the gopi because पूरा दुनिया में हमारा डॉक्टर बच्चे वेट कर रहे हैं हम ऑनलाइन आने के लिए हमारे साथ भजन करने के लिए. वेरी गुड, थैंक यू कीर्ति. वी विल कंटिन्यू द भजन इन दैट केस. राइट. राहुल व्यास भी कहते हैं व्यास महर्षि भरद्वाज महर्षि को बोल रहे हैं भजन को कंटिन्यू. पूजा से सर यू लोवर्ड माय स्ट्रेस सो मच. थैंक यू सो मच डॉक्टर. This is a really nice feedback, right? I will definitely remember and cherish the compliment, the good words you told today, Pooja. So, हम continue करेंगे PYQ पूजा. Now, CSOM में Pseudomonas aeruginosa. CSOM में seventh cranial nerve can undergo the injury. How do you treat eticoantral disease? One of the challenging situations. It is an indication for modified radical mastoidectomy. Once more, you need to know what is step up and step down procedures. What are the types of mastoidectomy, indications, everything you should read, doctor. Labyrinthine fistula most commonly involves the lateral semicircular canal in CSOM. How do you treat serous otitis media? It is often due to eustachian tube dysfunction. That's the reason Grommet is used to treat it. Multiple perforations in tympanic membrane. Classical of tubercular otitis media. Whenever there is a glue ear with an intact tympanic membrane, it leads to conducting hearing loss. अभी आ गया most challenging question. External canal का length कितना होता है? Length is 24 mm. Glomus jugulare originate from hypotympanic. So you have macula of utricle. Iska function is horizontal acceleration. Semicircular canals will identify rotational acceleration. Exhaustosis, they are very common in the tympanic part of the temporal bone due to cold water exposure. Exhaustosis can develop. So, when do you call severe hearing loss? If a person cannot understand normal speech, अगर चिल्लाए तो उनको समझ में आए तो severe hearing loss. Now, whenever there is a lateral sinus thrombophlebitis, there will be area of a small triangular gap called delta sign if you do CT scan. So today only go back to the Google images and look for delta sign of lateral sinus thrombophlebitis. कल के NEETPG में sure short image based MCQ. So now doctor, Deepak Pandre is saying कितने साल के PYQ करे सर? 2012 to 2023 10,000 PYQs को अगर आप रिवीजन करें तो मस्त. FMG बोले तो 15 इयर्स का ले लो, पकड़ लो. और INI-CET का लास्ट 10 इयर्स में 10 into 2 क्वेश्चन पेपर्स. एम्स एंड INI-CET का 10 into 2. You can even pick up 15 into 2, 30 PYQs. 30 एग्जाम का PYQs बोले तो 6000 PYQs का एक राउंड मार देना, मगर डोंट सॉल्व इट लाइक MCQ, सॉल्व इट लाइक single liners like this. So if you go to the learnograph.com, I provide the PDF with all the single line converted format with the topic classification, which will help you to cursorially revise for the last moment. Samter's triad is seen in asthma patients. Once more, what are the components of Samter's triad? I'm just leaving it for your imagination, for you to go back and review. Nasal polyps, what else will be there in the triad? Woodworkers में nasopharyngeal carcinoma is very common. Bacterial rhinitis is due to H. influenza. Klebsiella ozina lead to atrophic rhinitis. Whenever vasomotor rhinitis is there, we do Vidian neurectomy, is what you need to remember. Young's operation is done for atrophic rhinitis. Klebsiella rhinoscleromatis lead to rhinoscleroma. Reconstruction of both the ossicles and tympanic membrane is called tympanoplasty. जब आप मिरिंगोप्लास्टी कर रहे तो we use temporal fascia as the graft. Where is pyriform fossa? It is in hypopharynx. Plummer-Vinson syndrome में where do you see carcinoma? Typically, post-cricoid carcinoma is very common. Where do you see turban-shaped epiglottis? In tuberculosis. Oral thrush is candidiasis. What is BSGT? Begolini striated glasses test. Once more, go to the Google and quickly check what is the Begolini striated glasses test meant for. Right? So, very good. Husna Nas is saying, you are awesome, sir. Wow, Husna. Tomorrow I'll have a little coloring of my hair and everything and come to impress. So, thank you so much. 52-year-old teacher. Don't think he doesn't have a temptation to be flattered by 25-year-old. 52 or 25 may call reversal of numbers are there, Husna. Don't worry. Please compliment. We all love to be complimented. Right? Now, doctor. So, adult corneal epithelium. What is the cell density? 3000 cells per millimeter square. By the way, I'm not 52. I am 51. Just entered on June 6th. 52. So, retinoscopy, no movement of red reflex. If it is there, it indicates myopia of one diopter. Now, in our entire eye, to the refractive index, there is a contribution by various parts. Maximum refractive index is contributed by the lens. Imbertificla is associated with a plantation tonometry. Whatever, 29 online classmates for this midnight masala show, right? 48 hours before the NEETPG. Wow, this is great. This is great. अगर दम है तो बोलो, मुझे दम है, आपको भी दम है तो बोलो. संडे को एग्जाम है ना, सैटरडे शाम 6 बजे शुरू करके संडे सुबह 4 बजे तक पढ़ेंगे बोले तो भी हम तैयार हैं. अगर आपको दम है तो बोलो, ठीक है? If you feel good, better go to sleep early. But those who are the tensioners, anxious, उनके लिए I will conduct a marathon session, right? शाम 6 बजे से संडे सुबह 4 बजे तक, right? You can come. Shall we take this long challenge? Sometimes we should take challenge in life. बहुत भूख लगता है, हाइपोग्लाइसीमिया में जाता है, फिर भी हम वार्ड राउंड्स करना, ओपी क्लियर करना, 200 पीपल ओपी क्लियर करना, आईसीयू में राउंड्स करना, केस प्रेजेंटेशन करना, ये सब करना पड़ता है। कल नीट मीजी क्लियर करके आप रेजिडेंसी में गए तो। So what is life? Life is all about stamina. The more you juggle, the more you hustle, the more you struggle. There comes the result, doctor. So don't be afraid. Don't say I'm fearful of things. You will remember. Naturally, you will remember for the tomorrow's exam. So, doctor, continuing our discussion. Thank you for 25 people at Midnight Masala Show. You are giving company. Now, how do you know endothelial cell reserve of cornea? Specular microscopy. Aesthetometer will help you. Corneal sensation. Central 10 degrees vision is looked by Amsler's grid. Newborn's eye is a small eye globe. Always remember, small globe of eye will be hypermetropic. Large eyeball will be myopic. Don't forget. Gaze fixation कब होता है? When will the newborn baby will start fixing the gaze and watching the beautiful face of his mother and the nurse, if at all available, right? It occurs at 6 months. Subconjunctival cyst is seen in cysticercosis. Pterygium, what is the cause of blindness? Pterygium will lead to irregularity of the surface, leading to astigmatism. Pterygium, agar surgery kare to, recurrence is the most common problem. Trachoma mein scarring will lead to blindness. Angular conjunctivitis is due to Moraxella axon field. Keratitis is caused by the bacteria, atopy, protozoa, anything. Munson's sign, when a patient of keratoconus looks down, there is a bulge of the eyelid because of the keratoconus. It's called Munson's sign, is what you need to remember. So, my great-great-grandfather used to run a Vedic school. He's the great Bharadwaja called Avadhani. In those, if you look at Vedas, 5,000 years ago, Vedic period started. Rig Veda, Yajur Veda, Atharvana Veda. In those days, there is no script for Veda, you imagine. Early morning, in the river bank of the Krishna river, there used to be around 1,000 disciples reciting in the cold water, standing at early morning, 4 o'clock, the Veda. It's called Veda Patan. Imagine those days, from 5,000 years, still the tradition of learning Vedas without script is continuing. And we have so much script available. What is a big deal in doing the revision, doctor? So इसलिए आज मैं आयुर्वेदा की वेद पंडित आपके साथ आपको एक बड़ा डॉक्टर बनाने के लिए के कोशिश में, जैसे वेद पठन करते हैं, यजुर्वेदा, सामवेदा, कृष्णवेदा, ऋग्वेदा, we need to do the review of the PYQs. Axon field, Moraxella bacillus. मैं जिंदगी में कभी नहीं देखा, मगर इतने बार टीच किया, इतने बार पढ़ा एंट्रेंस के लिए, because it's a question, you can't help it, right? Now, Rahul says, please conduct one image-based question session. See, 50 full-scale grand test में Rahul, we have 2,000 image-based questions. Try to take opportunity. They are the best questions with clinical vignettes, just like the actual exam. कल के एग्जाम में ही ये ECG वाला क्वेश्चंस, एक्सरे, CT स्कैन वाला क्वेश्चन, सब कुछ वो full scale mock test which we hosted. 50 PDFs are made available. Please download and quickly do a review. All right. Very nice to see 34 online classmates, doctor. I want to see how many of you will join the marathon session 6 p.m. to next day morning on the day of the battle, Kurukshetra, right? So now, Corneal graft, it is 7.5 mm size with less failure. Where do you see pathological myopia में क्या दिखता? Pathological myopia में there is a degeneration of the globe leading to posterior staphyloma. Fuchs heterochromic iridocyclitis. There is a heterochromia of iris, keratic precipitates, and a posterior subcapsular cataract. Please don't forget. Optic canal is a part of what? Lesser wing of sphenoid. Presbyopia is treated with a convex lens. Gland of mole, it opens into hair follicle. What do you see in retinitis pigmentosa? Fundus mein? Jet black spots, which are like the bony spicules, and a pale waxy disc, optic disc, which is pale and waxy, classical of retinitis pigmentosa. Classical image-based MCQ, you should make sure that you do the revision. Vitreous hemorrhage, it causes sudden painless loss of vision. For vitreous hemorrhage, immediately you can't treat, long term you need to. Once more, what are the list of causes for painless and painful sudden loss of vision? You need to make the list, doctor, for the last moment review. Where all you see the cherry red spot? Niemann Pick, Tay Sag, central retinal artery occlusion. What do you see? Cherry red. Where is retinal detachment? Between neurosensory retina and the pigment epithelium, you have retinal detachment. Retinal tears are most commonly seen in primary retinal detachment. Methanol toxicity में which layer of retina? Ganglion cells are affected. Rexham's disease can cause retinitis pigmentosa. In pneumatic retinopathy, which gas is used? SF6 is being used. SF6. Beta blockers decrease the aqueous formation. Brimonidine, like clonidine, is an alpha 2 agonist used in glaucoma. Brimonidine also decreases the secretion of the aqueous. Will you use oral esdazolamide as a first line? No, sir. It is the last resort drug to treat primary open angle glaucoma is what you should remember. Secondary angle closure glaucoma. Where do you see? It is caused by pseudophakia. Pseudophakia. After cataract में यूज करने वाला लेजर होता है ND YAG laser. Where will you do incision in phacoemulsification? Phaco means lens. At sclerocorneal junction. Bilateral inferior lens dislocation is seen in homocystinuria. Superior lens dislocation, superior-temporal is seen in Marfan. देखो Marfan लंबू होता है, लंबू को Marfan बोलते हैं. So Marfan लंबू है तो ऊपर देखना पड़ता, ऊपर को कहते हैं superior, right? Superior-temporal is Marfan, inferior lens is homocystinuria is what you need to basically remember. So, medical doc is saying how to stay motivated and confident, sir. Feel like have to study still more. Beautiful. Aishwarya says, my stress gone. Excellent, doctor. Excellent. हम बहुत खुश हो गया, Aishwarya. Right? Oh God, Aishwarya said my stress is gone. Wow, that's good. Husna said you are awesome. Wow, 51-year-old teacher is getting a lot of encouragement to conduct a class morning, afternoon and evening also. Aishwarya, are you going to come? Right? So be motivated, doctor. There's only way. See, there are 4 things in our life. When they are there, we don't know their importance. When they are not there, we know. First, mother. There are many people who lost their mother in their childhood. But when our mother is there, we don't get time to sit with her and talk. That's the reason when mother is passing away, we feel, Arey, aur kuch din tum raho na ma. Why are you leaving me? Second is health. जब हमको स्वास्थ्य है, हेल्दी है, हम छोड़ते नहीं, हम उसको परवाह करते नहीं. The moment health is broken, we make a deal with the God. Please give me little health. Third is children. There are many people who don't have children. But when our children are there, we don't get time to spend with them. We are very busy doctors. Fourth is money. जब ऐश्वर्य हमारे पास होता है, हम उसको, we don't care it. But when we really don't have money and our necessities are dying, then we feel, oh God, why I don't have. NEETPG also is like that. When we have abundance of time in the beginning, we feel, पढ़ेंगे यार, आज नहीं कल, कल नहीं परसों. But when the exam is nearing, we suddenly feel we are short. Don't worry. Whatever you did, you did. What is left in next 48 hours, how you consolidate. That is all that is important. That is all that is important. सर आपको देखते ही मजा आ गया, क्या पावर है, वाह रे वाह. डॉक्टर जितू मीना, थैंक यू फॉर द कॉम्प्लीमेंट. सर 9 AM तो एग्जाम है, सोएंगे कब अगर आप मैराथन सेशन कंडक्ट करें तो. या दैट्स द रीजन आई सेड, those who are sleepless, those who are feeling that they want somebody to play the lullaby, I'm there to play the lullaby on Saturday. So if you're not getting sleep, join the lullaby, otherwise go to sleep, right? So doctor, enjoy the fun. Every year I wait for these last moments before exam because बहुत मजा आता है सारे बच्चों के साथ बैठ के पढ़ाई करने में, right? Now doctor, diabetic cataract, mainly sorbitol accumulation. Soft contact lens is made up of hema hydroxy methyl methacrylate, hydroxy ethyl methacrylate. How we used to remember? We used to have a very soft spoken classmate called hema. So soft contact lens means hema, hydroxy ethyl methacrylate. Now you should know what is first order, second order, third order in the visual pathway. Ganglion cells are the second order neurons. What is the action of inferior oblique, doctor? Extortion. So you should be very sure what are intortors, what are extortors, what are adductors, abductors, elevators and depressors. You need to be very sure on the extraocular muscles. Inferior oblique's primary action is extortion. Right isotropia indicates left lateral rectus paralysis. Dissociated vertical deviation is the feature of congenital isotropia, is what you should remember. Whenever there is a constant deviation in all the directions of the gaze, you call concomitant squint. In paralytic squint, diplopia is the classical feature. All the differences between concomitant squint, paralytic squint, you need to be very sure. Pituitary tumor compresses the optic chiasm, leading to bitemporal hemianopia. Whenever optic tract में lesion है तो you have optic nerve, optic chiasma, optic tract में lesion है तो Wernicke's hemianopic response. Once more, please take it as my word, doctor. One MCQ. Whenever you go to NEETPG, one MCQ, Arjuna, आएगा visual pathway, which lead to superior quadrant enopia, inferior quadrant enopia, macular sparing enopia. bitemporal hemianopia, binasal hemianopia. Everything you should be good. Just go back to the visual pathway defects. Right, doctor? Now, so please don't forget to like this video, share this video, tell all your friends about learnograph.com, be my brand ambassador to promote it. And also please write your comments below this video, as many as you can, and that will make the YouTube to make this naturally, organically viral. Now, doctor, trit anomalous means blue color appreciation is defective. Marcus gun pupil. Marcus gun phenomena is due to relation between fifth and third cranial nerve. Once more, what is Marcus gun phenomena? Marcus gun pupil. You need to go back and do the review, doctor. Brush field spots, single crease on the palm. They're all the features of Down syndrome. Intraocular neoplasm, most commonly is retinoblastoma. Axial proptosis is produced by the tumors which are retrobulbar. Stye is the gland of Jisca, suppurative inflammation, Jisca. Meibomian glands secrete the lipid. Whenever there is a dacryocystitis, 3-month-old child, massaging is the treatment. Acute dacryocystitis may, when there is a cellulitis, antibiotics are administered. Whenever congenital obstruction of the nasolacrimal duct is there, you need to do probing at 6 months. Whenever ptosis is there, you have to lift the eyelid by doing Fasanella Sarmat operation is what you need to remember. If it is a mild ptosis, is what you have to remember, doctor. Chalcosis, copper deposition, Kaiser-Fish cutting. Alkali burns hai to stage 1 is ischemic necrosis. Ocular trauma ko Betts classification is done. Fungal corneal ulcer may don't give steroid and worsen it. Myopia may, there is a contraction of the visual field and ultimately left is called tubular vision. Corneal xerosis is the xerophthalmia stage X2. For the sequencing, xerophthalmia, night blindness, conjunctival xerosis, corneal ulcer. Intraocular tension is identified by tonometer. Pars plana vitrectomy may we use 3 incisions. Pleomorphic adenoma will move the eyeball downward and outward. Frengel's glasses detect nystagmus. In pregnancy, increased respiratory rate leads to respiratory alkalosis. Turner syndrome में होता है coarctation of aorta. Pneumococcal meningitis, the drug treatment is given for 2 weeks. Whenever hyperkalemia is there, how do you treat? We give calcium gluconate. Why? Not to decrease the potassium levels, to protect the heart from going into cardiac arrest because of hyperkalemia. We give insulin and glucose so that insulin will move the potassium intracellular and decrease the potassium levels. Vitamin E deficiency lead to ataxia. Anti-tissue transglutaminase typically is seen in celiac disease. Ibuprofen causes aseptic meningitis. Foot drop, like in sciatic nerve, common peroneal nerve injury, lead to high steppage gait. Bronchial asthma में अगर chest became silent, it indicate a grave prognosis. जीवात्मा निकल रहा है आदमी के अंदर से अगर silent chest है तो. Typically bronchophonia, it's called egophony. indicates pneumonia. How does miliary TB spreads? Hematogenously through the artery. C1 inhibitor concentrator is the drug of choice in hereditary angioneurotic edema. The type 5, already we know 1, 2, 3, 4, 5 is also there. It mimics type 2. So go back and check what is a type 5 hypersensitivity. Broca's is a non-fluent aphasia. Wernicke's is a fluent aphasia. Broca's may comprehension is intact but not in Wernicke. Conduction aphasia is a fluent aphasia with a preserved comprehension and impaired repetition. Please don't forget. So all differences between Broca, Wernicke, conduction aphasia, you need to be sure, doctor. Arcuate fibers are affected in conduction aphasia. Whatever we finished 376 high yield facts, doctor. Kelte. Erb's point is also called neo-aortic area, is in the right third intercostal space in auscultation. Now, pheochromocytoma, phenoxybenzamine is the drug of choice. If the child's heart rate is 40, typically you manage by calcium chloride infusion. Very good. Kawasaki disease may coronary vasculitis lead to myocardial infarction. Persistent priapism is the feature seen in sickle cell anemia. Onion skin appearance of spleen is seen with SLE is what you should remember. In AIDS, the most common pulmonary manifestation is a pneumonia. Earlier days, pneumocystis carinii is most common, but now it is the bacterial pneumonias which are most common. The most common presentation of extrapulmonary TB is in the lymph node. Tubercular lymphadenitis is what you should remember. Whenever end-stage renal disease is there, how many times dialysis karoge? Weekly thrice. NSAIDs can cause interstitial nephritis. You should know what are the components of MELD score. One of the components is serum creatinine. Remaining components, I leave the homework to you. Whenever pulmonary fibrosis is there, HRCT is investigation of choice. In acute gout, colchicine for patients in whom you can't give ibuprofen, you can give colchicine in acute gout. Never give allopurinol in acute gout. It is only given prophylactically long term. What is good syndrome? Thymoma with immunodeficiency is good. In men, you have pancreatic gastrinoma, pituitary adenoma, and parathyroid. Pituitary, parathyroid, and gastroma. Of the three, gastrinoma is most common. When do you call moderate persistent asthma? If the symptoms are every day and the patient wakes up 2 to 3 nights a week, you call moderate persistent. Whenever there is a diurnal variation in peak expiratory flow rate more than 20%, that defines the asthma. In asthma, FEV1 by FVC ratio is decreased. HIV and TB, if they are coexistent, पहला TB का ट्रीटमेंट करो, बाद में सोच लेंगे HIV. Lung abscess. Most common cause is oral anaerobes. That's the reason 2 times mouth washing is important in life. Normal C-reactive protein with elevated ESR we see in SLE patients. Radiation can cause both restrictive and constrictive pericarditis. Crohn's versus ulcerative. Crohn's can lead to skip lesions. Iron dextron has the highest risk of anaphylaxis when you parenterally administer it. Of all the Von Willebrand, type 3 is the rarest type. Once more, different types. Where can you give the desmopressin? Where is it contraindicated? Which is autosomal recessive? Which is autosomal dominant? You need to go and revise. In miliary TB, pathognomonic feature is choroid tubercles. How will you make a diagnosis of pneumocystis pneumonia in AIDS? You need to do bronchoalveolar lavage with bronchoscopy. वारे वाह क्या बात है हम बहुत खुश हो गया थैंक यू सो मच Husna says, sir, your energy is giving immense boosting to study more. Definitely, doctor. That's the spirit. The role of teacher is not to teach you, but only add a few ATPs, adrenaline, hydrocortisone into your nerves to make you stronger and prepare for the exam. Once more, doctor. Thank you so much. Until your throat is choked, until you get cerebral edema, until your energies are dwindling down into REM, you need to keep doing the tapasya of the PYQs to become the winner in NEETPG. Don't worry, doctor. I'm Dr. Murali Bharadwaj, your classmate, roommate, benchmate, tablemate, always holding your hand until you get the seat. Once more, कल मिलेंगे फिर पढ़ेंगे एक दिन कामयाब होके दुनिया को बताएंगे कि भाई हमारा नंबर आ गया Thank you, Mansi, for the compliment that this session really helped you. Don't forget to like this video, to share this video, to write all your good comments, and also go to learnograph.com, download the PDFs and share it with your friends, and prepare better for tomorrow. Good night.